It has been a struggle for me to get you guys live, but through persistence, you know, we were able to make that happen. So I'm excited about that. Man, so sorry for my TikTok viewers. I just had to get, YouTube right. So welcome to the chat. Hey. Welcome to the chat, guys. Today is Ask Dr. Shon. Go ahead and put your questions in the chat. You guys are leading the chat today because you know I will talk y'all to death. She ready 89. Thank you for the rose. Happy Monday. Hey, Wanna. She said, hey, beautiful. Thank you for following Grocery. That's a funny name. I'm doing pretty good today. I can't complain. How y'all feeling? I can't complain at all for a Monday. I was just like so distracted. My computer wasn't working, but you know, I got a little IT in me. I'm okay. Amazing. Thank y'all for tapping those hearts. Let's see if we can meet our goal of 1K hearts on TikTok. Shawana said she's doing amazing. Okay, sis. We're trying to get to 1K hearts on TikTok. I cannot see how many hearts is pumped, but make sure you pump hearts, share the live, so that we can get this crack-a-lacking. Welcome to the Hood to Hooded podcast. I am your host, Dr. Cheetah's Sunflower. And today we are talking about teeth, but this is Ask Dr. Shon, so I want y'all to put your questions in the chat. Don't let me lead the chat because I will talk y'all to death. I want y'all to kind of engage. So make sure you are following. If you're watching on YouTube and you're watching this on the replay, go ahead and smash that subscribe button. Okay? Sending positive vibes. Glow. What's up? Thank you for following on Kick. All right, so let me ask you guys a question since the chat is kind of quiet on the questions. Let me just get your brain to thinking a little bit. When is the last time you actually thought about your teeth? You know, beyond just brushing really fast and running out the door, but actually like pause and say, hey, you know. So this is Ask Dr. Shon, where it's a safe space to protect your smile, your health, and honestly, your confidence. So if you have any questions, go ahead and drop it in the chat because your mouth is not separate from the body. And a lot of people don't really have access to talk to a dentist all the time. So I'm just here tonight, different from my normal popping off about history or teaching. And I want to just engage with you guys and see what questions you might have. And maybe we won't have any questions. And that would be kind of crazy, but, So we're going to drop a few dental gems that most people probably never learned while we are waiting on questions. I'm going to help you level up your daily routine without stressing yourself out because everybody can elevate their dental hygiene routine. I am probably like 99% sure about that. And we're going to ask questions, so don't be shy in the chat. If you watch this on the replay, you can also put your questions in the chat, and I will answer it. Okay? So if you ever said you've been needing to go to the dentist and you've been putting it off, tap that like button right now. Tap those hearts because this is a sign for you. Let's get into it with some dental facts just to keep us floating. And this might change how you think about teeth for you, your family, your friends, all of that good stuff, right? So 15 fun dental facts. Number 1, your mouth has over 700 bacteria. over 700. Not all of them are bad, but most of them are harmful, which is why brushing and flossing your teeth every day and then making this a habit in your household is super duper duper important. It is the easiest way to prevent um, caries, things like that, cavities, expensive dental care bills, now and in the future. You know, so if you didn't know that, or if you did know that, tap those hearts. Tap those hearts. Thank you, Wanna. Thank you for tapping the hearts. Number 2. Are you ready? Number 2. Cavities are kind of contagious. So not in the contagious where, sneezing, you get a cold, but kissing, you can spread, the bacteria that we just talked about to your partner. So you are sharing bacteria, sharing utensils. That's why you don't let everybody kiss your baby. You know what I mean? Because you don't know what's going on. You just don't. And if you do have a partner, make sure you are brushing and flossing because you don't want to pass bacteria to your partner. Someone said, oh my, yes. So the cavities themselves aren't contagious. It's the bacteria, such as Streptococcus mutans, that can be transmitted from person to person through saliva. All right? So kissing, sharing utensils, drinking from the same cup, even pre-chewing the food for babies, you are passing that bacteria to the baby potentially. All right? And this can set them up to get cavities, especially if you have a higher bacterial load of bad bacteria. Tap those hearts if that is a little bit shocking, or if you like, I already knew that. I definitely didn't know that. Yes is yes. Yep. A lot of people don't know that. So we're going over 15 things that is fun and hopefully engaging that can help us learn. Number 3, you literally produce about 1 to 2 liters of saliva a day. Unless you have like dry mouth or something like that from medication, different health conditions can give you dry mouth. But most people produce 1 to 2 liters of saliva a day. Now that is normal. So you want to have saliva in your mouth because it helps kind of wash away the bacteria. It moisturizes your food. It helps you swallow, all of that stuff. All right. So if you have dry mouth, the best thing is to drink a lot of water. And they do have things like Biotine and other mouthwash is on the market that can help with that. You just have to tell your dentist what's going on. Even when your saliva feels off, let the dentist know. Number 4. All right, tooth enamel is the hardest substance in your body. So it's harder than bone. It's the hardest substance in your body. But even still, bacteria are so strong and the acid is so strong that it can still break down the enamel. So it's hard, but it's not like unbreakable. You can still do damage to your teeth. So that's why we have to take care of our teeth. Make sure the kids take care of their teeth. Make sure they're brushing, they're flossing, so that you can pass down good oral hygiene habits, right? Number 5, bleeding gums are not normal. So if your gums are bleeding, this is not normal. I like to tell my patients you should be brushing 2 times per day with an electric toothbrush. I'm not promoting the oral BIO, but I like spin brush, the spin brush effect. I think it gets the teeth a lot cleaner. But brushing with any toothbrush is better than no toothbrush at all. You feel me? So as long as you're brushing your teeth. Now, if you're trying to elevate your oral hygiene routine, I definitely recommend a spin brush. Now, some of my patients, they go to the store and they like, Dr. Shon, this brush, they got a whole wall full of toothbrushes. Some of them $400. You do not need the $400 toothbrush unless you got it like that. The $30, $40 one, $50 one, if you want a couple extra features, you can stay in that range. You don't got to go that far. Unless you just like on this whole oral hygiene makeover and you just got to have it. To each his own. But to do what you need to do just to keep your teeth clean, you don't need much. Even a normal toothbrush is better than not brushing at all. Now, flossing is non-negotiable. One time a day. If you don't floss right now, I need you to start flossing today. Not tomorrow. Say it with me, guys. Today. If you're going to start flossing today, tap those hearts. And if you're watching it on the replay, make sure you smash that like button and drop me a comment. Say today. I'm going to do it today. All right? The next one is flossing adds years to your teeth's lifespan. Why is that, you wonder? Why would flossing add years to my teeth's lifespan? Because if you don't floss, it's like going to the bathroom and not wiping afterwards. It's like taking a bath and not using like soap and all of the stuff that gets you clean. It's like just standing in the shower and getting wet. It's a process to it. So if you're not brushing and flossing, you're only doing 60 to 70% of the job, which means you're leaving all of that food and bacteria between the teeth, which is going to break down that enamel and cause you to get buy one get one free cavities. This is cavities that happen between the teeth. Interproximal caries are buy one get one free. So you'll be like, dang, I got 2 cavities for one? Yes. So not only does flossing prolong the life of your teeth, it also, if you don't do it, it will increase the amount of your dental bill. Okay? The next thing, number 7, dry mouth equals higher risk of cavities instantly. Why is that? Remember, normally the body produces, or the mouth produces 1 to 2 liters of saliva in a day. And if you don't have saliva to wash the bacteria away, to, rinse the acid off your teeth, to kind of like help your food go down, to keep your mouth moisturized so it's not getting dry, which makes a great environment for bacteria, some of the bacteria, then, that's a problem. So that's why if you have dry mouth, it instantly increases your risk of getting cavities. Okay? If you got any questions, drop them in the chat. Drop it in the chat. And then we're going to go on to number 8. Now, number 8, you would think most people know number 8, but I don't know. Maybe they don't. Your teeth can't heal themselves like skin. They cannot heal themselves. They do have different... Now, this is a disclaimer. There are products on the market such as Curldont, which can help the tooth remineralize, but not if the decay has reached a certain point. So this is if you catch cavities early, like when they are like just beginning, not even out of enamel, because there are layers in the tooth. There's enamel, dentin, and then you go into the nerve tissue. But if it's still in enamel, the cavity hasn't went that deep, you can use these Curldont like substances, and they can help remineralize your teeth without a drill. This would mean you will have to go to the dentist every 6 months. You're getting your cleanings, you're flossing, like you really trying to have your teeth forever. You're really trying. And I meet so many people, they're like, well, I don't have, no, if you have teeth, you want to protect them. I don't care how many you have, make sure you just start today. Because each one is like priceless. Each one. You know what I mean? Thank y'all for tapping the hearts. We're trying to reach our goal of 1K hearts on this live. I don't know how many we have right now, but I hope you guys are tapping if this is helping you out some kind of way. Number 9. The bad breath that you experience, 9 times out of 10, is coming from your tongue, not your teeth. But there's also a disclaimer now. If you have all types of calculus and calculus bridges and food, old stuff between your teeth, it can come from between your teeth. But 9 times out of 10 is coming from your tongue. So make sure you are cleaning your tongue. How many people skip that part? See, we talk about brushing, flossing, but we don't really brush the tongue if you don't know, But your tongue is a part of the oral cavity, and you want to keep it clean as well. get a tongue scraper. Just have you a nice luxury oral hygiene routine. This is how you start your morning off. Like, this is the first act of self-care, is just taking care of you by brushing your teeth, flossing, washing your face, getting yourself together. You will feel so much better. Like, you know what? I did one major thing to my health today. Especially if you have other systemic diseases. This can, well, we're going to get into that in a second. All right. Acid, aka soda and juice, softens the enamel for 30 minutes after you drink it. So I would just recommend not drinking soda, especially. It's terrible for your teeth. Where are my soda lovers? Where my soda lovers at? The Mountain Dew, the Coca-Cola. This is straight acidic, you know, and it's going to erode your teeth. All right? If you continue to drink soda every day, this can lead to permanent enamel loss, and like we said, it does not regenerate. It can lead to staining, cavities, just all types of issues. So definitely limit your intake of acidic foods and beverages. The best drink is always going to be what? H2O. Now, the reason why we want to know that after you drink soda or juice, your enamel gets soft is because you want to wait at least an hour before brushing after acid exposure to avoid further enamel abrasion. Okay? That's just a little FYI. The next thing is, what number are we on, guys? We did bad breath. We did acid. Number 11. Grinding your teeth can crack them without you knowing. So, if you are a clincher or you grind your teeth at night, I would highly recommend getting like a night guard. If you have a lot of expensive dental work, you have crowns and bridges or implants, things like this, you want to make sure you have a night guard to protect your investment. Okay? But if you're grinding your teeth, this is going to cause long-term damage. It's like a foul on your teeth, and then eventually you can get sensitivity, pain, tooth loss, mobility, terrible things. So grinding can crack your teeth. And a cracked tooth is not, you can't save it. It's hopeless. It's not a good thing. Number 12, oral health is linked to heart disease and diabetes. So that's why earlier I mentioned if you have other systemic diseases, having poor oral hygiene is going to make your heart disease, diabetes worse. Because what is diabetes? Sugar in the blood. You know, sugar is bad for your teeth. So high sugar in the saliva is going to make you have a higher risk of oral hygiene issues, right? If you have a lot of calculus in your mouth, some of that plaque could go down into your heart, cause issues and build up, and it's not good. So make sure you are keeping your mouth extra clean. Not only just because you should do it, but especially if you have other systemic diseases. Number 13, whitening toothpaste does not actually whiten deeply. Okay? So it removes the surface stains. It has to be like a really, really strong percentage of the whitening agent to really make a difference. So be careful with whitening because this can create sensitivity a lot of the times and other issues. So I'm always cautious about whitening, especially if you have cavities or you haven't had a cleaning. You're not like consistent. I would first get a checkup, a cleaning, and then do whitening if you qualify. But you have to ask a licensed dentist to see if you're a good candidate for it. If you have sensitivity already, absolutely not. I'm just going to tell you that virtually. It's only going to make your sensitivity worse. Okay? Number 14, you should replace your toothbrush or your toothbrush head on your electric toothbrush every 3 months or sooner. So ask yourself this question honestly. When is the last time you changed your toothbrush? Are all your bristles flattened? It's time for a new toothbrush. Has it been 6 months? It's time for a new toothbrush. Those bacteria that we talked about earlier, those streptococcus mutans, P. gingivalis, these things build up on the toothbrush. There's lots of germs, so you don't want to continue to use the same toothbrush forever. Even with your kids, make sure you are buying them new toothbrushes frequently and not having the same toothbrush for a whole year sitting on the cup in the bathroom on the counter. Switch it out. All right? And then number 15, if your gums are receding, they don't grow back naturally. So the lack of flossing, the lack of brushing causes buildup at the gum line. This causes your gums to recede and it's not coming back. So if you look in the mirror and you notice, dang, I got some buildup right here. My gums are like leaving. That's not going to come back naturally. Maybe with some type of periodontal surgery, which is not cheap. It's better to just keep it. If you got it naturally, try to keep your natural features, because to go and have gum procedures and go to specialists and implants, all this stuff is super expensive. And I feel like every year is going higher and higher. So make sure you just do what's natural, easy, and the cheapest first, as the first line of measure. Don't wait until things get so bad. Some people, they feel in their head that if I don't think about it, they say men are like this about health. Not all men, but they be like, men don't like to go to the hospital, the doctor, because they feel like if they know about it, it's going to get worse. But it's kind of like the same with teeth. A lot of people, just men and women, feel like if they just wait until something hurt, then they're okay. But the worst thing you could do is to wait until it hurts, because if it hurts, either you're getting ready to lose a tooth or you're getting ready for a very expensive dental procedure. So why not catch these cavities before they hurt? Why not go and get your cleaning and a checkup and an exam before it hurts? So that way your dental bill might be just to get your cavities done. They might say, oh, your treatment plan is $1,200. But this is going to fix some cavities. You're getting a cleaning. You're getting caught up. You feel so good and confident that nothing is brewing, like a problem isn't brewing. Some people are waiting and they have so many problems brewing, and the longer you wait, the worse it is with dentistry. It's not the other way around. It's not, oh, if I wait long, then it's gonna go away. No, if you wait long, you wait wrong, because you never are supposed to wait for these things to get bigger. If these bacteria are already 700 plus different types, and you're waiting for them to just destroy your teeth, and by the time they get through that enamel, which is the hardest substance in the body, oh, it's over with. If there is hope, because there's a such thing as hopeless teeth. There's a such thing as moving teeth. Teeth are moving. You can't really do anything if you're losing bone. Your teeth are deteriorating and you are waiting. So don't wait. That's the biggest thing. Don't wait. And if you must wait, make sure you are doing what you need to do at home, just so that it doesn't get worse. Because if you do nothing, you hear me? Do nothing, it gets worse, guys. It's going to get 10 times worse. It's worse if you say, you know what, bump Dr. Shon, I don't give a darn what she's talking about. I ain't brushing or flossing tomorrow. You ain't hurting me. You hurting yourself. Every day you do that, you hurt yourself. Every day you wake up and you're like, I don't feel like flossing. Bump that floss. You hurting your own teeth. If you never learned this habit, you are hurting yourself. If you have diabetes, you're making it worse. If you have heart disease, you're making it worse. If you have bone loss, your teeth are moving, you have sensitivity, some pain over here, and you're not brushing, flossing, trying to at least stop it, it's only going to get worse. And I hope that makes sense. Nowadays, a lot of dentists have membership programs. They have financing. Even with 500 credit scores, I know we offer that, where you can try to get some of your work done, and it's not so much up front. But I feel like people think it's going to be so expensive and they're scared of the big treatment plan. But dentistry is not done oh, you need all this work done because you've been waiting. It's done in phases. You're going to do the worst thing first. Get the worst thing done first. Then you can tackle the rest of the things. Don't just wait for everything to get worse, though. The signs are pain. Pain, you need to act fast. Period. A little bit of pain is something is wrong. Your teeth are talking to you. They're like, hey, you got something over here, and we're warning you. Please get this handled before you know, before I ruin your day or ruin your night. Because the toothache in the middle of the night is no fun because everybody's closed and now you have to go to the ER. Okay? So they like, hey, you got a little sensitivity, you eating ice cream. You like, ooh, that didn't feel too good. Go get it checked out at that point before it starts to hurt constantly. Because then all you can think about is this toothache. But if it's giving you signs, go ahead and listen. Do whatever you can do to handle it, because if you don't, eventually it's going to make you stop everything. And that's how normally people get back into the dentist, is after they waited so long, they just like, nope, I'm not focusing on this. I'm busy. Bump my teeth, bump me. I got to eat though. And then something happens and it's not good news. All right. So if you're watching this right now, drop a tooth in the chat if you learned something new today. If you skip flossing, go ahead and tap those hearts. I want you to do better. Love your teeth. If you're going to love your teeth from here on out, tap those hearts. Hit that like button. And if you have any dental questions, drop it in the chat. Okay? So, loving on your teeth, taking care of your teeth, it's not about perfection, family. It's about consistency. Just a little bit each day is what matters. And with oral hygiene, it doesn't take an hour. See, when you're trying to work, that takes 8-9 hours a day. Working out, creating content, all these different things like traveling. Brushing your teeth is one of the easiest tasks of daily living that you can perform, that will make you feel so good before you start your day and before you end your day. Brushing before bed, flossing before bed, you will feel amazing. So just practice small wins, a little bit at a time. If you have a storm brewing, don't look at the whole issue. Just start very simple. Let me just get the routine together. All right? So that is my little tidbit for this lovely Monday. Y'all know I stay dropping the facts and sometimes the dental facts to keep us motivated every day, to promote healthy smiles, especially for the youth, and to promote self-care and consistency. Because you can't go from hood to hooded if you do not take care of you first. All right? So part of this podcast is about history, positivity, and inspiration, but a big part of it is oral hygiene. I was just on Facebook last week, and they have this program that is like a 7-year doctoral program between TSU and Meharry Medical College, and they had 0 melanated, aka black men, to join the program. 0. So there's a dire urgency for us to continue to promote oral health care awareness, to promote oral health careers, especially in our community, to the women and especially the young men who look like me. We need more male dentists. It's crazy how this started out as a predominantly male profession, and now more women are entering it more than men. It's kind of crazy. So if you're a young man out there and you're thinking about being a dentist, I say go for it. There's a need and an urgency for you to apply. If you have the grades and the mindset to take on this profession, we need more of us in this profession. Period. I have people call all the time looking for, what do they call it, a bolt pop? Let's call it a black owned practice. I guess a bow pop. I don't know. An indigenous, I call it, but you know, I get it. A melanated practice, we'll call it. And people feel comfortable going places where the dentist looks like them. Just period. So find a dental home where you can be comfortable with your dentist and stay on track with your oral hygiene routine. That's my tip. All right. So we didn't get any questions in the chat. So I'm about to hang it up, y'all. Let's hang this thing up. Hey, we met our goal of 1K hearts, though. Look at y'all, TikTok, 2.9K hearts. Hey, thank you to my heart pumpers tonight.